At Caregility, our passion is connecting care everywhere. We are an enterprise telehealth solutions company, and we are humbled that for 2 years in a row, our Caregility Cloud was recognized as best in class, setting the bar for all non-EMR virtual care platforms. By harnessing what we've learned in working with more than 1,000 hospitals across the US, we are excited to introduce a new enterprise-wide telehealth solution concept. Inpatient virtual engagement is designed to help providers deliver hospital-based hybrid care at scale, every room, every bed, every patient. The solution removes clinical blind spots and bridges gaps in care by enriching bedside nursing with virtual workflow support, improving patient outcomes and lowering costs while reducing clinician workload and burnout. Hybrid care is the future of telehealth. It's the best of both worlds, conducting in-person clinical encounters when needed and supporting virtual interactions whenever practical. This is especially valuable in acute settings, like hospitals, where resource demands are high and care delivery is complex. Let's look at some examples. A patient is admitted to the hospital with severe abdominal pain and diagnosed with acute pancreatitis. To improve multidisciplinary communication and prevent contradictions and confusion, the attending physician schedules hybrid telerounding sessions. The patient, his nurse, and the attending physician are present in the patient's room, while the gastroenterologist, surgeon, and the patient's spouse join the sessions remotely. Everyone stays on the same page. The patient understands his care plan, and his spouse is relieved to have their questions answered by specialists. In another scenario, a new nurse needs to set up for an arterial line insertion. He requests an ad hoc telenursing session with a seasoned nurse in a remote call center who walks the less experienced nurse through the process while keeping a watchful eye on the patient. The patient's heart rate is elevated and blood pressure appears to be low. The virtual nurse asks the new bedside nurse to use the digital stethoscope so she can remotely assess heart tones. The digitized heartbeat and EKG are transmitted to the virtual nurse, who's able to verify that the patient is okay and provide a teaching moment to the new bedside nurse. Let's look at one more. A care team decides to put a patient with a history of mild dementia on round-the-clock observation and registers him for telesitting. The patient is continuously monitored by a trained staff member in the remote observation hub. The patient need only use their call button to request help to go to the restroom or if additional support is needed. The remote sitter keeps vigilance and redirects the patient as needed and can quickly alert floor staff if required. Inpatient virtual engagement poses countless opportunities for hybrid care enablement, improving the care experience for patients and clinicians alike. We understand that scaling your telehealth services for every patient bed across your enterprise can be challenging. You want technology that blends into the background. Our full-service approach makes adopting hybrid care models easy. We have the experience, medical-grade devices, technical resources, clinical expertise, a robust platform, and a proven track record to get you there. We are a passionate partner that takes hybrid care seriously. Each of Caregility's access point-of-care systems is custom designed. We have a range of medical-grade systems tailored for all high, medium, and lower clinical acuity settings. All of our wall-mounted systems and mobile carts include night vision cameras and support remote pan, tilt, and zoom controls for clinicians. Caregility's devices are self-contained, so they don't require host computers or consumer add-ons to function. Our newest system, the Low Acuity APS 100, is a cornerstone of inpatient virtual engagement. This economical, feature-rich device has a sleek profile and interfaces with the patient's smart TV to further reduce its footprint. Like our larger wall units, the APS 100 integrates with interactive patient systems and supports Hospital Room of the Future initiatives. Designed for lower acuity environments, it is the workhorse that will make up most of your telehealth fleet, enabling virtual clinical workflows system-wide. Yet even with all this extraordinary value creation, hybrid care at scale needs to be financially viable. That's why inpatient virtual engagement is a solution as a service. For total peace of mind, the subscription-based approach combines everything you need into a monthly or quarterly pay-as-you-use service. Dedicated software applications, a fleet of medical-grade devices tailored to your unique needs, CareAgility cloud platform services with centralized program and device fleet management, ongoing upgrades and technology refreshes, and renowned customer service. Finally, CareAgility Connected is our unparalleled ecosystem of innovation partners, service providers, and channel partners. From integrated solutions like Echo's digital stethoscopes and Telehealth's Rothman Index clinical decision support, to interpreter services and outsourced provider referrals like Equum, CareAgility Connected further extends the value of inpatient virtual engagement. Our recent partnership with CDW Healthcare offers simplified procurement and service delivery. We hope you'll build your next virtual care program on us. Contact us today to learn more.